Uh-huh.
Capsulectomy means removing the entire, the capsule. And there's extent of that, right? There's some surgeons that will do it through this small incision, and perhaps they'll just remove the portion of it that is symptomatic and leave a lot of it behind. And then there's some surgeons that will remove the entire capsule. And then when the entire capsule is removed, then there's a whole other realm of how precise you are with removing that capsule and minimizing the collateral damage to the remaining breast structures. Obviously, the less damage we cause, the more breast tissue we have to work with, the more function we're going to have. But that is another level of precision that, that's something that is sort of my standard. This is why a lot of patients see me for this procedure, but it does require a longer incision and a lot more time.
And why would some women want or need their capsule removed and others might not care about it?
Well, the obvious answer is if there's a capsular complication. For instance, the capsular contracture is by far the most common complication, where the capsule gets very hard and stiff, becomes very hard scar tissue, which is very symptomatic, palpable. Patients can feel it. It actually restricts range of motion, and that's an obviously indication to remove it. The capsule can also be pulling, in very thin patients, it can cause traction on nerves and cause just kind of like phantom pain in certain areas, phantom itching or burning because it's close to a nerve. So sometimes removing that helps. Sometimes if a capsule is left behind, then there are some complications that can still happen down the line. They're very rare, but they can happen, and I've seen them. Sometimes the capsule can fill up with fluid and become a cyst, and patients come back with a fluid-filled, kind of like a small seroma pocket that is symptomatic, especially on a very small breast that's left behind. Sometimes the capsule can contracture later. If you really dive into this, the FDA had reported 28 cases of squamous cell cancer that they found in latent capsules that was found much, much later. So that's a very rare complication. But for all those reasons, a lot of patients just want that peace of mind and say, like, you know what, if I'm going to remove my implant, I just want everything associated with that implant to be removed as well.
And do it all at the same time and really kind of bite the bullet. And because I think what you're bringing up where you could leave it in, it's more simple, but then maybe it won't even look as good. Like if things are kind of pulling or stuck together. And then also, that worry that later there could be some other thing that could happen. Out of 10 patients who want their implants removed, how many want the capsule?
My experience is very skewed because patients seek me out for implant capsule removal for the most part. I would say in general, it's very different. I think there's a lot of surgeons that may not have this entire conversation with patients, and they may just take the slightly simpler route. And frankly, if a patient has a very soft capsule that is not symptomatic and they just want their implants out, then a lot of those patients will basically, the surgeon will say like, yeah, you can just leave your capsule in, that's fine. And they sort of knowingly or unknowingly accept a very, very small risk of a complication down the line. Maybe 80, 90% of the time, nothing will happen, and the patient will never even know that the capsule is left behind, and they'll be fine for the rest of their lives. But in some small instances, that capsule can come back to haunt them later on. And in my patient population, a lot of the patients have done their research, and they have sort of been made themselves aware of these, rare but real things that can happen down the line. And for this reason, they come to me with the mindset of like, hey, let's just get everything out and let's just do it the safest way possible.
Yeah.